It's amazing to think that something so tiny, like a trace element, could have such a huge impact on your health. We're talking about selenium, and today we're going deep into its fascinating connection with your thyroid. You guys sent in some amazing research on this, and we're excited to really break it all down.
Yeah, it's really remarkable. When you think about it, selenium is absolutely vital for thyroid health. It's not just, kind of involved, it's fundamental.
So let's jump right in. How would you describe selenium's role in how our thyroid hormones are regulated?
Well, imagine your thyroid is like a factory.
Yeah.
It's producing hormones, right? And selenium is a key component in that machinery. Specifically, it's essential for converting T4, which is that storage form of thyroid hormone, into T3, the active form that your body actually uses.
So it's not just the thyroid pumping out ready-to-go hormones. There's this conversion process that has to happen.
Exactly. It's like, think of a car, full tank of gas, but no ignition key. Selenium's like that key, letting you convert T4 to T3. It's essentially activating the thyroid hormone, making it usable.
That makes a lot of sense. And this conversion, you said it relies on enzymes, right?
Right. These specific enzymes are called deiodonases. And selenium, well, it's a vital cofactor for those enzymes. They just can't function properly without it.
I see. And there are different types of these deiodonases, right?
Yeah, there are three main types, each with a specific role, and they're located in different parts of the body. This really shows how intricate and finely tuned this whole system is, how selenium affects things beyond just the thyroid gland itself.
So if someone is deficient in selenium, this conversion process gets messed up and their thyroid can't function the way it should.
Exactly. And that's where we start to see the potential consequences of not getting enough selenium. And it can really manifest in a lot of different ways.
So let's talk about those consequences then. You mentioned selenium deficiency can lead to a bunch of thyroid problems. What are some of the specific conditions that are linked to low selenium levels?
Well, the research you sent over highlights a few key ones. Hypothyroidism, where your thyroid's just not producing enough hormones. Autoimmune thyroiditis, like Hashimoto's disease. That's where your immune system is actually attacking your thyroid. And then there's goiter, which is an enlargement of the thyroid gland itself.
Wow. Okay, so low selenium isn't just a minor inconvenience. It can really set the stage for some serious issues.
You're absolutely right. And the concerning thing is that research shows that if you're deficient in selenium, you have a higher risk of developing these conditions.
That's definitely something to think about. It highlights how crucial selenium is for a healthy thyroid. Let's delve into some of these conditions, starting with Hashimoto's disease. The research you shared included this meta-analysis of a whopping 35 randomized controlled trials looking at the effects of selenium on people with Hashimoto's. That sounds pretty impressive. Can you tell us more about what they found?
Yeah, that meta-analysis provided some pretty compelling evidence. Basically, they found that taking selenium supplements led to some pretty notable improvements for people with Hashimoto's, especially for those who weren't on hormone replacement therapy yet.
Interesting. So while selenium isn't replacing traditional treatment, it could be a helpful tool in managing Hashimoto's.
Exactly. It's a potential tool, but it's always important to work with your doctor to figure out the best approach for your individual needs.
Absolutely. Now, the research you provided also mentioned some specific improvements that were observed in those taking selenium. What were those?
Well, in some cases, the study showed that selenium supplementation helped lower those TPOAB levels,
TPOAB, those are.
thyroid peroxidase antibodies. They're a key marker for autoimmune thyroid disease. So seeing those levels drop suggests that selenium might help modulate the immune response. And some people even reported feeling less fatigued, less depressed, which are common symptoms of Hashimoto's.
So selenium might offer some relief and improve quality of life for people with Hashimoto's. That's really encouraging. Now let's switch gears to another autoimmune condition, Graves' disease. This one often comes with this really tricky complication called Graves' orbitopathy, which affects the eyes. What does the research say about selenium and managing this condition?
Graves' orbitopathy can be really tough to deal with, and the research on selenium is pretty interesting. Studies have shown that when people with Graves' orbitopathy take selenium compared to just using standard anti-inflammatory meds, they see improvements in their eye symptoms. And their overall quality of life improves too.
So there's hope for those dealing with this complication. It sounds like selenium might offer some relief beyond what traditional treatments can do.
It's promising, for sure. But it's important to remember that we're still in the early stages of understanding exactly how selenium works with Graves' disease and the eye problems that come with it. More research is definitely needed.
That makes sense. Science is a process, right? It's always evolving. Now, let's move on to goiter, that enlargement of the thyroid gland. You mentioned low selenium could be connected to this as well.
That's right. Studies have shown that being deficient in selenium can actually contribute to goiter development. And what's really interesting is that research has shown that supplementing with about 200 micrograms of selenium daily can help shrink goiter size. That's something that people can really see and understand.
So, in some cases, selenium supplementation might not only fix the deficiency, but also visibly reduce the goiter itself.
That's what some of the studies suggest, yeah. But it's important to remember that goiter can have a lot of different causes. Selenium deficiency isn't always the only culprit. So it's essential to see a doctor to get a proper diagnosis and figure out the best way to manage it.
Right, it's not a one-size-fits-all solution. You have to look at the individual situation. Speaking of individual needs, let's talk about dosage. How much selenium is generally considered safe and effective for all these different thyroid conditions?
Based on the research you sent, the recommended dose for conditions like Hashimoto's, Graves, and goiter seems to be around 200 micrograms per day. But I can't emphasize this enough. That's just a general guideline. Individual needs can be totally different.
So, not everyone should just take the same amount.
Exactly. Things like your age, overall health, how severe your thyroid condition is, and even your genes can play a role in how much selenium is right for you. It's really crucial to work with a healthcare professional to figure out the right dose and how long you should take it.
So, it's about finding that sweet spot, the right dosage for you. And this highlights how important those regular checkups and blood tests are. You need to know how your thyroid is doing and what your selenium levels are.
Absolutely. It's all about open communication with your healthcare provider, talking about your concerns, and working together to create a plan that supports your thyroid health.
It's a partnership, not just blindly following orders.
I couldn't agree more. It's about actively participating in your health and making informed choices.
That's empowering. Now, you mentioned how long you should take selenium, the duration. What's the typical time frame for these thyroid conditions?
The research you sent suggests that treatment can last anywhere from 3 to 12 months, depending on what condition you have and how well you respond to the selenium. It's not a quick fix. It's about making selenium part of a longer-term strategy for managing your thyroid health.
It's about consistency and commitment, not just a temporary solution.
Exactly. And it's important to remember that selenium is just one piece of the puzzle. It's not a magic bullet, right? It needs to be combined with other things like a healthy diet, managing stress, and all those other lifestyle factors that can affect how your thyroid functions.
It's about creating a supportive environment for your thyroid to thrive. Selenium's important, but it's not the whole story.
You got it. And it really highlights how connected nutrition and thyroid health are, something a lot of people might overlook. And, that's where things get really fascinating. That research you found about general recommendations for selenium, well, it suggests the dosage can actually vary based on your TPO-AB levels.
You're right. That was a detail I found super interesting. For those listening who might not be familiar, TPO-AB stands for thyroid peroxidase antibodies. They're these markers of autoimmune thyroid disease, like Hashimoto's. So even if your thyroid function seems normal, if your TPO-AB levels are high, that could mean you need selenium, something to talk to your doctor about for sure.
Exactly. The research suggests that if your TPO-AB levels are really high, like over 1,000 IU/ml, you might benefit from taking up to 150 micrograms of selenium every day.
Yeah.
But if your levels are lower, the dose could be somewhere between 50 and 100 micrograms per day. But again, those are just general guidelines. It all comes down to personalizing it based on your needs and what your lab tests show.
It's not a one-size-fits-all situation. You've got to find that sweet spot, the amount that's actually effective for you. This really shows how important those regular checkups and blood tests are. You need to keep tabs on your thyroid function and know what your selenium levels are.
Absolutely. It's all about having that open conversation with your doctor, not being afraid to share your concerns, and then working together as a team to come up with a plan that's going to support your thyroid health.
It's about being an active participant in your own healthcare, not just passively going along with whatever's recommended.
I couldn't agree more. Don't be scared to ask questions, to really dig into the research and advocate for yourself. The more you know about your body and how things affect your health, the better choices you can make.
That's such an important message. Now, as we start to wrap up this selenium and thyroid deep dive, what are some key takeaways you want our listeners to walk away with?
Well, I think it's important to remember that selenium isn't just some random trace element. It's essential for thyroid health. It impacts hormone production, protects the gland from damage, and might even help manage certain thyroid disorders.
It's like this silent hero working behind the scenes to keep your thyroid running smoothly.
Exactly. And even though selenium deficiency might not be talked about as much as other deficiencies, it's definitely something to pay attention to, especially if you have any worries about your thyroid.
So getting those selenium levels checked could be a great first step, especially if you're experiencing any symptoms.
Yeah, I agree. And don't forget, it's not just about supplements. You can get selenium from your diet, too.
That's right. Brazil nuts, seafood, eggs, meat. There are lots of delicious ways to boost your selenium intake naturally.
And this whole deep dive really highlights how intricately connected your nutrition and your thyroid health are.
It's a holistic approach to taking care of your thyroid, understanding that things like diet play a huge role in your overall well-being.
Precisely. And that's true for your overall health and preventing disease, too. What you eat, how much you move, how you manage your stress, it all has a ripple effect throughout your entire body.
It's about taking control and making choices that support your health journey. And those choices can sometimes be as simple as, snacking on a handful of Brazil nuts or choosing salmon for dinner instead of chicken.
Exactly. It's about making those small, conscious decisions, the ones that add up over time and create a foundation for optimal health.
Love that. So before we wrap up this fascinating deep dive, I've got one final thought-provoking question for you guys listening. We've explored this amazing link between selenium and thyroid health, but it leads to a bigger question. What other lifestyle factors, beyond just this one trace element, could be affecting your thyroid? Something to think about, right?
The exciting thing is, you now have this deeper understanding of how something as tiny as selenium can have a massive impact on your health. Use that knowledge wisely. Talk to your doctor, research things for yourself, and remember, you're in charge of your own health.
We've really gone deep on selenium and how it affects your thyroid, but this is just the beginning, right? There's always more to learn.
Absolutely. It's a journey. And like we said, knowledge is power. Don't be afraid to talk to your doctor, do your own research, and really explore all those things that could be influencing your health.
You guys have gained some incredible insights into how your body works and how even something as small as selenium can make a difference.
It's pretty amazing when you think about it, right?
It really is. So use this knowledge wisely, make those informed choices, and be in charge of your own health. That's what it's all about.
That's the best advice I can give.
Well, on that note, I think it's time to wrap up our selenium and thyroid deep dive.
It's been fun.
Until next time, stay curious, stay informed, and stay well.